All right, thank you everybody for joining us tonight. I would like to welcome you to tonight's presentation. Um, this presentation is being offered by the Sashbear Foundation, and we are pleased to bring you this opportunity to hear from another expert in the area of emotion dysregulation. This is part of a series that we have been offering since almost a year ago. And so Sashbear is a registered charity in Canada, and you can find out more about us at our website and social media, which is here on this slide. As a charity, we depend on donations to continue our work. And you can make a donation through Canada Helps. You can find us on social media, our website at sashbear.org. And if you have any questions, you can contact me at the Family Connections email, which is fcprogram@sashbear.org. One of the Sashbear Foundation's major activities in Canada is offering the Family Connections program for family members of those who happen to have emotion dysregulation or some kind of related or similar issue. This year in January, we kicked off our brand new year with another 22 groups in both English and French. And all of these groups are delivered by trained volunteer leaders. I just want to highlight that at this time, about 5% of the participants in the groups that we're offering right now are supporting someone who is under the age of 12. And so actually, sorry, supporting someone who's under the age of 10, and actually almost 20% or more are supporting someone who's under the age of 16. So this evening's webinar, hopefully some of those same people are here. This is obviously a really important demographic, and there's a lot of need in this community. This webinar will be recorded, so if you have to step away, or if you have trouble hearing, or want to rewatch or relearn any of the material that's covered tonight, it will be made available on our YouTube channel. And so just to reassure you, because it's a webinar, your name, your face will not appear at all in that recording. We will have time for some questions at the end, and our presenter tonight, Dr. Perepletchikova, has agreed to stay until 8:15 to answer a few questions for us. So please put your questions into the Q&A or into the chat, and we will get to them at the end of her presentation. So before we introduce our guest speaker, I would like to introduce some of the others who are with us here today. I have with me Lynn Corey, who is the president and founder of the Sashbear Foundation. Thank you, Lynn. I have Kathleen and Lisanne here with me, who are volunteers with the Sashbear Foundation and are helping out with the chat and the technical pieces for this webinar. And I would like to introduce you to Annie Desjardins, who is one of our co-facilitators for the Family Connections program and a former board member for the Sashbear Foundation. And Annie will be introducing us to our guest speaker tonight. So Annie, please go ahead.
Thank you, Doreen. Hi to all. I had the privilege to meet Dr. Francheska Perepletchikova 5 years ago, and it is a pleasure and a great honor to introduce her to this educational webinar. So Dr. Francesca is a founding director of the Youth Dialectic Behavior Therapy program that focus on treatment of children, adolescents, and young adults. We did the DBT model and provides training in the approach. She received a Ph.D. in clinical psychology from Yale University in 2007. From 2012 to 2020, she was an assistant professor of psychology at the Weill Cornell Medical College, Department of Psychiatry. She has a long-standing interest in emotion regulation, trauma-related psychopathology, suicidality, and self-harm behaviors. A research focus on childhood psychopathology and psychotherapy development. Dr. Francesca developed and evaluated DBT for pre-adolescent children with severe emotional and behavioral dysregulation. This line of research has been funded by grants from NIMH NIH, NRSA, and private foundation. Dr. Francesca authored 30 journals articles, book chapters, and a book named Treatment Integrity in Treatment Outcome Research in 2009. So, Dr. Francesca, thank you to be with us.
Thank you, Annie. And it's a pleasure and honor to be introduced by you. We go some way, and it was my privilege, and I was very happy to know you and to know your family and to do the work that we did. So thank you for this introduction.
Thank you.
Hi, everybody. So as Annie said, my name is Francheska Perepletchikova. I am a person who is very interested in children and who is very interested in parenting and who is very interested in helping children, and particularly those who, as we maybe already know by the coin, coin word that kind of becomes a thing associated with children who are emotionally dysregulated. My pleasure and my interest is to work with children who are quote unquote a supersensor. So today we're going to talk about that and the challenges and the privileges in having a supersensor and the challenges and privileges in raising a supersensor and some of the key principles behind the intervention that I have developed to help parents and to help these children with the associated behavioral dyscontrol. So here we go. So Super Parenting 101. You can imagine that I work a lot with this population. And as you know, in DBT, those of you who are familiar with this intervention, we use metaphors a lot. And one of my favorite metaphors of all times about parenting, I stole from a father that I worked with. And he once told me, after several attempts of trying to change some of the ways in which he was trying to raise his child, he told me this: Francesca, you like metaphors, he said. Let me give a metaphor. He said, I see children as blocks of marble. And I, as a parent, supposed to come into this world and make that block of marble into a David. So I am a Michelangelo to my child. And you know what? I jump into the air and I said, oh my God, this is the best metaphor I've ever heard about parenting. And I'm going to steal it from you. And there's just one tiny, tiny, tiny correction. Children are born Davids. Beautiful, wonderful piece of art created by God, universe, nature, whatever you want to call it. And we as parents, our job is not to make a David out of David in our own image. Our job is to see the David in a child, love the David in a child, and make sure the child sees the David in themselves and loves the David in themselves. We indeed, as we know, come into this world already packaged. Who we are, what we like, what we don't like, our predisposition for psychological disorders, physiological disorders, our talents, our learning differences, our temperament, our personality traits, glass full. And this is the David that we're given. Now, what does happen sometimes is that parents may, instead of seeing the David, may indeed see the block of marble. And they then do indeed sometimes take a hammer and a chisel and try to hammer that David into something else. And that actually only can destroy the David as opposed to love the David, right? So if you use our brain, another metaphor, we're having another metaphor here, as a biological computer. right? Children understand computers, so I try to go with what children understand, and they see computers, get computers, so I'm using that metaphor with them, so therefore I'm giving it to you. If you see our brain as a biological computer, that David becomes a hardware, right? Comes into this world. Now that David, the beautiful, wonderful piece of art, now is starting to interact with the external environment, immediate family, extended family, school, peers, the culture. And through that interaction, in DBT, it is called transaction. We're transacting. The variable of a child is transacting with the variable of the environment. Transaction means that they are influencing each other as they are transacting, and they are indeed adapting their behaviors to each other. So within the metaphor of a biological computer, what is happening is this. The environment and the child through that transaction, it starts to write a software, right? Software is all of the learning that the child is sustaining in the environment. And software is how much of that David is actualizing, being pronounced or not, right? If I, in my David, is supposed to become a ballerina, but my parents want me to become a mathematician, right? So I will not get the necessary training for ballerina, probably will not be a ballerina, and probably will not become a good mathematician either, right? So this is the software that's being written. Software means programs, learning that we're sustaining throughout the life. Now, the third metaphor that we're using is the iceberg. The iceberg is our psyche. The iceberg is, just as we know, above the waterline, we have our conscious awareness. This is the thoughts, the memories, the associations that are on the conscious level. And below the waterline, we have this much bigger mass that is unconscious, not in level awareness. So this hardware and the software, all of these guys live below the waterline. And you will understand why that is important as we keep going in figuring out what is it that we need to do to help our supersensors. So what is the David of the supersensor? The David as a supersensor comes like any other David, comes with free gifts and challenges. Two sides to everything. The dialectic even exists in the David. The free gifts, talents, for example, ability to draw, ability to sing, it's free, right? I didn't have to do anything, was born that way, right? And then challenges, some of the things that we need to work through, that by the end, when we do work through them, become rewards, become gifts, sometimes the most important gifts of all. Now, what are we talking about with the David of a supersensor? The David of a supersensor came with a very sensitive emotional apparatus. That is very sensitive emotional apparatus means that they have a challenge of high emotional sensitivity. What is a high emotional sensitivity? Low threshold. Little things bug them, right? Can actually be things that other people don't even understand where is it coming from, right? Could be internal memory or thought, can be external that other people are not even registering, right? It does not take much for a reaction to occur. It comes with high reactivity. It goes from 0 to 100. Goes from 0 to 100 in a split second, right? It's high intensity. Slow return to baseline. It takes time for the reaction to go back to the baseline, right? So this is what we mean when we say high emotional sensitivity. And of course, with that high emotional sensitivity, we of course are going to have emotional behavioral discontrol, such as frequent, temper outburst, physical, verbal aggression, sometimes, unfortunately, also suicidal ideation, behaviors, non-suicidal self-injury. Now, people with emotional sensitivity, they have to, they live with this what I call a double gravity effect. What is a double gravity effect? Double gravity effect is they not only have to withstand the impact of the stressor that's coming their way, they also need to withstand the impact of the high emotional reaction given the stressor, right? So it's kind of like double gravity means that you're walking this earth with your own weight on your shoulders. When you do that, it's really not that you want to run, right? You want to like lay down somewhere and rest, right? So this is, if you think about it, our supersensors, people who are emotionally sensitive, they are going, through life having to deal with double the whammy, so to speak, right? Now, the thing about that is that we can't lift the double gravity. They always are going to be emotionally sensitive. When we're talking about interventions, when we're talking about treatment, we're not talking about changing the child. No, we can't change. He came already prepackaged, right? We can't make him any different, not that we want to. What we're talking about is that we need to help these children build enough of the emotion regulation muscles, so to speak, right, to withstand the force of that double gravity. Children with emotional sensitivity frequently have additional difficulties, right? It comes in a package. What does the package look like? Now, look at that one. Parents are coming in and the times they're saying, well, you know what? My child is lazy. Well, the thing is, maybe it's not about laziness. Maybe it's about the double gravity, right? Because your child, given the impact of this double gravity, again, is not looking for the opportunities to run, right? He actually does not want any more stressors coming his way that he needs to withstand, right? So sometimes what they do, they kind of shield themselves from other things, and that can be seen as avoidance, that can be seen as laziness. They are, of course, hyperreactive. They have a lot of verbal, physical aggression, suicidal ideation, self-harm behaviors. They really have difficulty tolerating change and transition. They are very easily bored on top of that. They have very low tolerance to delayed gratification. They want what they want immediately right now, give it to me. Have rapidly shifting attention. A lot of the time they're actually being misdiagnosed with having ADHD, and on top of that, they also have hyperactivity. Now, of course, they're displaying a lot of impulsive behaviors, and at least in the studies that I've conducted, at least actually about 70% of these children also have some sort of sensory processing issues, sensitivity to light, touch, to smell, to taste. It looks like this emotional apparatus, the wiring, is not only about the emotional reactivity, but also about the sensory, the physiological reactivity, right? Everything is heightened, everything is heightened. And if you can imagine, the 70% of these kids are walking around being hyper-reactive, not only to their emotions, but also to the input from the sensory, right? This is a lot of things that are going on. Of course, they're being overwhelmed pretty much at all times. They, a lot of the time, have severe interpersonal difficulties with parents, with siblings, with peers, with teachers. They have extreme thinking style. They get stuck in black and white thinking, catastrophizing. Now, a lot of the time, that's a very interesting one. A lot of the time, they're coming in and sometimes they're actually misdiagnosed as having an autism spectrum because they, quote unquote, missing social cues. Well, that may not necessarily be so. What that could be is something different. These children, and we talk about it more when we talk about the fact that these children are indeed having benefits on top of challenges, right? Everything has two sides. Being super sensitive emotionally has benefits as well. And one of those benefits is they're able to read other people's emotions very well. And that is pretty much like reading other people's minds, right? Because we communicate at least on two levels, a level of words and a level of emotional expression, the tone, the facial expression, how the person said it, right? We don't trust words. We trust the way it was said. So if I tell you, I like you, as opposed to I like you, right? Same words, very different meaning. Supersensors can read the underbelly. They can read the actual intention. When a person is saying, hi, how are you? And actually what they mean, I hate your guts, right? Supersensors are reading, I hate your guts. However, there is a discrepancy between what the person is saying and what they're actually meaning. And a child who may not necessarily read the underbelly, he may respond just to words in what's called a socially normative way. A child who's reading the actual meaning of what's being said and there's a discrepancy, they may not actually know what to do and how to react to it, right? And therefore they may not react normatively to this, and that can be seen as missing social cues. So supersensitivity, as you can see, presents with the ground for a lot of misdiagnosing and overdiagnosing with ADHD, with issues with being on the spectrum, specifically if you have sensory processing issues. So on top of that, most of those children have problems with brushing teeth and other forms of hygiene, right? So this is the package. Not all children have all of that, but this is the package of challenges that comes as a part of the David. Now, two sides to everything. The dialectic of the emotional sensitivity. We talked about the challenges. Now let's talk about the advantages. They're not only able to experience negative emotions on a very high level, right? Of course, they can also experience positive emotions on a very high level, which can, a lot of the time, go into the emotion mind of them becoming silly, right? As we said, they can very well read other people's emotions. Also, because they experience their own emotions on a heightened level, they can be much more empathic, much more caring, much more understanding in their balanced moments, of course, right? So the empathy is also heightened because they can feel the pain of another human being. And there has been huge amount of research done on that. Emotional sensitivity is highly correlated with increased creativity. I actually have, the research on that is highlighting, such aspects as if you have an emotional range, like everything has a range. Let's say a regular human being, I'm just making it up, a regular human being has an emotional range of +5, the most happy they felt, -5, the most miserable they felt, right? Supersensors may have +10, -10, +15, -15, and all possible variations. So what they're actually having is an ability to pick up more dots, more information dots in the environment, and pick up little things in the environment that other people don't. They can see patterns where others see randomness because they can pick up more information. They can find a meaning, in minute things of every day, and they can experience world in which there, again, as I said, more dots and more opportunities for connection. So of course that presents them with a much better ability to be creative. So I love this quote by Pearl Buck. She said, and this is in my mind, applies to each and every child that I see in my practice who's a supersensor, and not just child, also an adult, right, who's a supersensor. The truly creative mind in any field is no more than this: a human creature born abnormally, inhumanely sensitive. To him, a touch is a blow, a sound is a noise, a misfortune is a tragedy, a joy is an ecstasy, a friend is a lover is a god, and failure is death. So this is, in my mind, is a very good representation of a lot of what we see now, supersensors. They are truly creative minds. And again, the benefits and the challenges. This is the free gift, right? Being truly creative. And they presented with challenges that they need to work through in order for them to take full advantage of the benefits and not being stuck in the challenges. And that's exactly what we are doing here. Now, unfortunately, being sensitive, emotional sensitivity acquired a negative connotation, such as a person being touchy, defensive, uptight, paranoid, neurotic, right? So instead of using emotional sensitivity and like being associated, oh, you're so sensitive, instead of that, I am using a very different term, which you already know, a supersensor. This is pretty much with the analog of, for example, super taster, right? A person has more taste buds on their in their palate, and they have a benefit of being able to appreciate the nuances of the tastes and the textures and the smells. They can become food critics and chefs, and of course they have challenges. They cannot have hot foods. They present with a lot of issues with what kind of food they're going to be eating. They're pretty finicky. All kind of things are happening, right? Two sides. So the supersensor, when you actually use that as that term, what happens with that, of course, immediately it decreases the risk of pathologizing, right? It avoids a risk of invalidation. It provides the dialectical view, right? Immediately we're talking about both the challenges and the benefits. And once you talk about it from that perspective, both parents and children all of a sudden getting this insight that being a supersensor, being emotionally sensitive, it's not a psychiatric problem. It's a blessing in disguise sometimes, right? It's a gift. It's not a psychiatric problem. What you have is this. What you have is a special super ability. And what you need to do is learn how to better control it, right? It's not a problem to correct. It's a skills that they need to learn and knowledge that they need to acquire, of course, together with their parents on how to deal with the challenges to fully benefit from the gifts that being a supersensor brings. So now let's talk about the other side of it, right? You see, we're being very dialectical here at each and every step. Or the entire life is about dialectics. Now let's talk about our supersensors need super parents. So let's talk about the environment side of that. So what are we trying to help them do? We're trying to help them regulate emotionally, right? What does it mean? It's an ability to modulate our experiences, right? Subjective, physiological, behavioral, and being able to measure them and connect them and regulate them as per environmental demand, as per the demand of the situation. Now, not every supersensor, not every sensitive person may necessarily develop emotional dysregulation. When we talk about emotional dysregulation, now we're talking about not just being emotionally sensitive, now we're talking about that emotional sensitivity has been pushed to such a degree that now it became clinically significant. And now it became a problem in terms of impeding the ability to function. So what is emotional dysregulation? It's having emotional sensitivity and having no ability to modulate those emotions upon the demand of the situation. If it is left untreated, unfortunately, research shows that children who have emotional dysregulation don't grow out of it. In the childhood, these children are a lot of the time diagnosed with what's called disruptive mood dysregulation disorder, right? In the future, the projected diagnosis, usually we know what research shows where these children may be heading, the higher risk of psychopathology in the future in adolescence and adulthood are usually personality disorder. Most of the time is borderline personality disorder, of course, depression, of course, anxiety. And then we get into alcohol use, substance use, suicidality, self-harm, all the things that these children are unfortunately collecting along the way, trying to deal with their supersensitivity by trying to cope with it in ways that may be short-term effective. When you cut yourself, that is the most effective way to decrease your emotional arousal in the short term, above and beyond drugs or alcohol, because those take time. Skills, forget skills, that takes even longer, right? But cutting, unfortunately, and that's how brain works, can provide this immediate relief. So in the short term, it works. In the long term, of course, it's a disaster. So, but they're picking up those coping mechanisms, dysfunctional coping mechanisms along the way, and they can transition all the way to a clinical disorder. Not every supersensor develops emotional dysregulation. So when we're talking about emotional dysregulation, we're talking about the combination between the child, the David, right, and the environment. The emotional dysregulation is not something that the child is already born with. No, child is born with emotional sensitivity. But then the transaction with the environment can be so that that transaction can lead to the development of the emotional dysregulation. And why is that so? Number one, please remember, and I know a lot of your parents, and like right now, probably you're sitting there thinking, oh my God, it's all my fault. No, it's not. Until a couple of years ago, actually before I even done my randomized trials, we didn't know what to do with these kids, right? Well, we diagnosed them as bipolar and we were giving them a lithium or something else, right? I have children coming into me who are 9 and 10 who are on intravenous ketamine. For those of you who don't know what ketamine is, this is a horse tranquilizer. PRN, intravenous. Yes, Yes, psychiatrists don't know what to do with them either, right? And that's why they're trying to control the behavior, because the behavior is so unsafe. So even our field, the psychology and the psychiatry field, did not know what to do with them just a couple of years ago. So how we parents are supposed to know? We don't. We're not born with that knowledge. And most of the parents, they have multiple kids, right? And they see these two are kind of fine, absolutely fine. And this one is just climbing walls and freaking out, right? So what that means is parents most of the time are very good enough, very capable parents, and they're doing absolutely wonderful parenting to those two kids. Just this one needs something else. So when we talk about invalidating environment, I actually don't like that term that much, but that's what it is. Invalidation, the only thing invalidation means is something doesn't make sense. Validation means makes sense. Invalidation means doesn't make sense, right? So when we talk about invalidating environment, it means that this is the environment in which child's behavior does not make sense to parents. They don't know what to do with it. And then they're communicating to the child that the child's behavior doesn't make sense, right? And then you have this transaction in which the child's needs are not met because parents just don't know what to do with the kid, right? And they're not born with that knowledge. If you have a child who, God forbid, have diabetes or whatever, you don't know what to do with that. You need to go to a professional to get help, right? The same is here. So, so we need to remember. We need to remember. So those of you who are parents right now, I want to ask you a question. All right. Okay. I want for you right now, feel guilty for not being born as Superwoman or as Superman. Feel guilty right now. Are you feeling it? Are you feeling it? Are you feeling it? Probably not, right? So this is the same thing. Nobody's as born as a super parent. We learn how to be a super parent because we learn what these children actually need, how to address their needs directly, right? And that is why we need to go to a professional who actually knows what to do, hopefully now, and give you that knowledge. What is a super parent? I give my parents this metaphor, right? Super parents are like firefighters. Number one, firefighters do not start fires themselves, right? What does it mean in terms of parenting? That means don't model behaviors that you don't want your child to do. Don't scream at your child. Of course, don't beat your child up. Don't model the behaviors you don't want your kid to do, right? Don't retaliate. Don't invalidate harmfully. On the other hand, firefighters are not afraid of the fires, right? They're not afraid of the fires. What does it mean in terms of parenting? No accommodation. What is accommodation? Accommodation is I, parent, am afraid of you, a kid, because I know that if I ask you something, you're going to go ballistic. So I'm going to start tiptoeing around you. And as soon as I start accommodating, it grows geometrically and it gets worse and worse and worse. And then we are accommodating this kid. Kid is not learning anything. And there are many, many other side effects for accommodation. And this is what it means. Don't be afraid of the fires. Do not accommodate, right? Now, so that's don't start fires. Not afraid of fires. What is our synthesis? What's in between? Firefighters calmly and skillfully put down the fires and work on preventing those fires from starting all together. What does it mean in terms of the parenting? It means holding and containing your child. One of the examples of holding and containing your child, for example, is ignoring. What is ignoring? I don't see you, I don't hear you, I don't talk to you as you're doing maladaptive behavior. So the child is raging there, and what I'm doing is I am calmly waiting for the child to come down, which is the most important and needed thing to do in that moment. And so what I'm doing in that moment, I'm containing and holding my child's rage. Metaphorically speaking, of course, I'm not talking about containing the child. Validation, prompting and reinforcing adaptive behaviors, all the contingency management technique, if you think about parent management training, right? Doing daily reinforced practices of the skills, right? And of course, working on own parental emotional regulation, because if you are not regulated yourself, there's nothing else you can do for your kid, because you will not be able not to model negative behaviors, right? You will not be able to ignore, you will not be able to validate, you will not be able to do anything. So you need to work on your own emotional regulation first, right? The mask first, the mask on you, and then on the kid. So how do we work with what we have? Now, if you think about what is feeding into the reaction, what is feeding into the response, everything has two sides. Again, the dialectic of it. The dialectic of it is external controlling factors. That's one side of the field. And of course, on the other side, we have internal controlling factors. Now, what are external controlling factors? These are the events that come from the external environment that elicit, reinforce, punish, extinguish, shape our responses, right? If we think about parenting, that's a lot of contingency management, things like that. Now, what is internal controlling factors? And this is something that you probably, if you know DBT, a lot of what I said already kind of resonates with what you know. What I'm going to introduce right now is not something that is in DBT for adults and is not something that is in DBT for adolescents. DBT for adults and adolescents, even in the name of it, dialectical behavioral therapy, is circumscribed, and this is what Marcia is talking about in the book as well, to external controlling factors only, per se. In DBT for adults and adolescents, we're not talking about internal controlling factors, external controlling factors, and that's what we're targeting, right? Dialectical behavioral therapy, right? Responses, right? Now, DBT-C is bringing in another side of the spectrum, and now in DBT-C, we're introducing, working also on the internal controlling factors, and these are helping parents and children decrease or increase, right, vulnerabilities in their core senses: self-love, safety, belonging. I'll tell you what that means. Now, let's kind of like look at it visually. So this is the difference between the internal and external, right? Those of you, for example, who know what chain analysis is, right? Chain analysis is about external controlling factors. What has happened, right? This led to this. So this is about what happened, right? This is what was the event. I had a thought, I had a feeling, and then he said that, and I thought that, and I had that feeling, and then I did this, the vulnerabilities, and then the consequence, right? This is what happened. All of that is pretty much reconstruction of what happened that we have on a level of awareness right here, right? We remember, all of it's there, we just need to reconstruct it, right? Help our client reconstruct it. Now, when we're talking about internal controlling factors, so now this is this level. Now, internal, we're going down. Why it happened, not just what happened. Now, internal is why it happened. So let's first briefly touch upon external controlling factors. So the best way is to just to look at the emotion wave. This is just straight from the manual. So these are the things that we are going to be targeting in DBT, right? So the emotion wave consists of first the vulnerability factors. Those are the factors that are increasing chances of negative behavior happening. They don't cause the behavior, they just increase chances of the behavior. Like, for example, I woke up sick. So I will be more irritable. And so now I will maybe reacting to things that I would not have been reacting yesterday, right? That's just increasing my vulnerability, right? Then we have an event. Then we have an interpretation of the event, very important. We don't react to events. We react to meaning or interpretation we ascribe to events, right? One person, one event, 5 people, 5 different reactions. Why? Because 5 different interpretations, right? Very important. Then out of the interpretation, we have an emotion reaction connected to the meaning we ascribed to the event. Every emotion comes with action urges, telling us what to do. Anger tells us to fight. You know, fear tells us to hide and run, right? Happiness tells us to jump up and down, right? And smile and laugh, right? Now, the next step is action, whether or not we're actually going with the action urge, right? And then we have after effects, consequences, positive, negative, other thoughts, behaviors, which can actually start the whole new wave, right? So External controlling factors, we are targeting all these things, right? We're targeting vulnerabilities. We're decreasing vulnerabilities in terms of the, health issues, sleeping right, eating right, exercising, all of those things that can be feeding into the vulnerabilities. Now, with events, we're teaching children to problem solve. We're also using exposure techniques, right, to prevent emotion from happening, right? If we problem solve the situation, we no longer have the emotion. If I expose myself to fear to spiders, next time I see a spider, I'm no longer having fear because it's out of my system, right? So that is working on the event per se. Now, on the interpretation of the event, we are using cognitive restructuring, right? Even introducing children to such a thing as dialectical thinking, that is already cognitive restructuring, thinking, oh, things have two sides, completely different way of thinking already, like thinking outside the box immediately. Then emotions. Now, emotions by themselves, we can't do anything about because it is what it is. We feel what we feel. The only thing we can do with the emotion is we can either decrease the frequency of the emotion happening altogether, problem solving, cognitive restructuring, exposure, or once we have an emotion, we have a chance and a choice, if we can, to decrease the duration and severity of that emotion. And that is when our skills are coming in. Mindfulness, catching the emotion before it realizes into action and saying, wait a second, no, I'm not going to do that. And I'm going to do the skill, right? So now we're talking about mindfulness. And now what kind of a skill? That's our distress tolerance. That's our emotional regulation, interpersonal effectiveness, right? And then after effect, this is our contingency management, right? All of the things that are reinforcing, punishing, and extinguishing the behavior. So this is pretty much the outline in just one slide of the entire external controlling factors within the DBTC at a glance. Now let's take a little bit more time with internal controlling factors, because these are the things that are going to be new to you. And I know that I only have 3 minutes left. Internal controlling factors. So what we as parents need to do, our parental job, remember how I said about the David, is to see the David in the child, love the David in the child, help the child see the David, and love the David. That is paramount importance. So that is one of the tasks. What is self-love? We need to instill an ability for the child to experience self-love. This is stable and enduring sense of loving self as is, not conditional, no requirements, no conditions. I love me just because I exist, which pretty much what it is, right? We as human beings, we're neither good nor bad. We just are. Just like universe, just like sun, earth, this pen, we're neither good nor bad. What we do can be useful, not useful, helpful, not helpful, effective, not effective, given the goal only, what needs to be connected, right? But me as a human being, I cannot be bad, I cannot be good. I just am, like Earth. Earth is not good or bad, just is, right? So I need to establish a relationship with me in which I have peace with me, I love me, no matter what. And this is very critically important. As you can imagine, when we are associating our relationship with us with conditions, in order for me to love me, to be good with me, I need to be good, be worthy, earn $1 million a year, whatever, right? Condition. When we associate it like that, what happens is life is about win some, lose some. Goes up and down, right? Win some, lose some, right? It's filled with learning, therefore it's filled with mistakes. And mistakes are about disappointment, right? So other people love me, I'm good, right? It's connected. My self-appreciation, my peace with me, my love to me is connected to that condition. Somebody doesn't like me, I'm bad, I'm not lovable. I did something really well, I'm good with me. I made a mistake, I'm bad with me. You see? So our relationship with us is going up and down, impossible. One one-sided. As soon as you're one-sided, you are not being able to balance. You tip over and you get stuck. Why do you get stuck? Because of nothing on the other side to balance you back up. What do we need to do? We need to do a very important thing. We need to teach our children to do that. We need to do it ourselves. People don't know how to do it. We need to separate it. If we're talking about dialectic, things being balanced means two things on different sides of the spectrum that are complementary, not the same, complementary, but competing, different. Night, day, good, bad, yin, yang, right? Two complementary. So if this is life, up and down, win some, lose some, win some, lose some, win some, lose some, right? Going up and down, hectic, you never know what's going to happen. Things just come your way, right? If this goes like this, what needs to be on the other side to balance it? This is not going to be balanced when both are fluctuating on both sides. This is not going to be balanced with both are static and set in stone. It needs to be like that. This is life. This is my relationship with me. I love me regardless of what goes there. Win some, lose some. Then we can actually go with the fluctuation with life without stepping on all over our own self-love. This is critically important. Why? Because when things are fused like this, right, conditions are fused with my ability to be at peace with me and love me, I will start to do what? I will start to artificially decrease fluctuation of life, so it doesn't fluctuate that much. So I have very low ability to feel bad about me because nothing is happening. What does it look like? Avoidance. What does it look like? Over control. What does it look like? Trying to force other people to do what you want, right? Artificially restricting life from happening. Not gonna work, not gonna happen, right? But people have to, because it's very hard when your vulnerability in your self-love is going to be increasing, right? So when we have an ability to get in touch with our self-love, just as we are, doesn't really matter what's happening, no conditions, no requirements, beautiful things, marvelous things are going to happen. Me as a person, I can actually now appreciate my David, right? I can enjoy who I am, not what other people want me to be. Who I am, my ability, my talents, my inclinations, also the mastery, the interest that I acquired, right? The expertise. And very importantly, it will allow me as a person to accept me as imperfect when environment imposes standards. And environment always imposes standards. Family, parents, grandparents, teachers, culture, society, religion, standards. You have to be like that. And we can't satisfy all these standards. We're gonna fail. And the problem is, if we don't have this cast in stone, unmovable self-love on its own island, we're going to crumble, because we're always going to be defective and deficient and not good enough and not worthy, because some standards will not be satisfied. This is critically important. Now, of course, parental love for the child provides this foundation for the child to be able to have the ability to experience it, right? And if we get stuck in the picture of the child should be, then it becomes an issue, right? Because what you're communicating to the child, the David that you are is not good enough for me. I need a different David. What kind of David are you? No, forget your David. You need to be the David in my image. That's what we need to happen, right? To make happen. No. So immediately when we have a shoot for the child, destroys the kid, because we are not Michelangelos. Forget it. We're not Michelangelos, right? God is a Michelangelo. We're not, right? Our job is to receive and love, not make. And of course, pervasive, indiscriminate invalidation, when parents are judgmental, critical, it interferes with child's ability to experience self-love, because they feel deficient and defective. They are not even good enough for the parents who's supposed to love them just because I'm existing. If they're not loving me just because I'm existing, if they can't do it, then who can? I can't experience my own. Now, the second one is a sense of safety. Now, sense of safety refers to realistic appraisals of the dangers and my own ability to handle problems, right? Of course, it starts to develop with a secure environment where caregivers are providing stability, consistent protection, support. And from there, child starts to develop more of their sense of safety through the experiences that the child is having, in which he can see, yes, I can handle problems, right? I have a healthy ability to face challenges, not run away from them, and figure out what to do. Because safety is about not yesterday. I don't care about my safety yesterday. It's not even about right now. 99% of the time, we're kind of safe, right? We're still ridden with anxiety. Safety is about what? 1 second from now, will I still continue to be safe? And that relies on my ability to predict next moment, right? And that relies on my ability to know, to learn, to say to myself, yes, I can. The only thing that we can control in this life is me. I can't control other people. I can't control circumstances. The only thing that not forget control, that's the wrong word. The only thing I can influence in life is me. What I feel, what I think, what I do, and my biology. That is it. And if I can't even influence that, remember, every time child is having a temper tantrum, losing it, that is immediately is going to go into the vulnerability and sense of safety, because I can't even control myself. How scary is that? I cannot even predict what I am going to do the next moment. That is very scary. So when we're teaching skills and child is actually seeing that they can actually be on top of it and can be the boss of themselves, that is helping with the sense of safety as well. Now, of course, inability to rely on consistency, protection, emotional support from parents, and also parental accommodation of dysfunctional behaviors interferes with child's ability to trust self, others, and to trust the world. Now, the last one, sense of belonging. We as human beings, we cannot survive by ourselves. We need a group. And for that, nature put in us the need to connect, to develop relationship, and to develop rapport and attachments. So all those inborn needs, right? And sense of belonging starts to develop within the family, right? Through a positive caregiver-child relationship. And in a situation when parents are frequently downward comparing, why can't you be like your brother? Why can't you be like your neighbor? Why can't you be, right? Critical, judgmental, retaliatory, invalidating, punishing, pretty much signaling to the child, you are not good enough. You are not accepted. And sometimes even you're not wanted, right? So all these things can indeed interfere with our ability to regulate, because we're not loving ourselves. We are not feeling safe. And sometimes we're not feeling that we belong anywhere. So us as parents, what we need to do is this. When parents come to me, I tell them this. Your child with emotional dysregulation, and of course they're coming to me, they have a clinical issue. Unfortunately, they are on the way, right, this right railroad of a higher risk of developing psychopathology in the future. As soon as you came in and started to learn the super parenting, because in DBT-C, the primary target is not the child. The primary target is the parent and parental ability to become a super parent. And as soon as a parent becomes a super parent, I say, bye, we're done. You can take that kid and you know what to do. Good luck, come to me for booster sessions, right? I am not going to be there for years. I want the parents to know what to do. So as soon as parents learn the super parenting, because listen, in DBT, and even in DBT for adolescents to some degree, DBTC has a huge advantage over the other ones, huge advantage, because in DBT for adults, whatever happened to the child in the invalidating environment is done. We're just pretty much trying to figure out what to do with the aftermath, right? I, in DBTC, have a wonderful advantage, a wonderful ability to intervene in the environment right now, this moment, as this transaction is occurring, so I can change, I can help parents change the transaction. And of course, in the two variable system, child parent, if we're talking about which variable is more important to start with, to begin with, and to end with, of course, it's the parent, because parents are the most important and the first programmers for the child. Remember, software. You're writing software for your kids. So as soon as you start to learn to be a super parent, you help your child jump tracks. You jumped tracks. And now your child is on a way of increased probability of adaptive functioning. Now, your job is just to keep the kid on that track and not be attached to the outcome. How long it will take, whether the kid is going to backtrack or go to do offshoots or whatever, get stuck somewhere, is not that relevant, because everything that we're doing is about long-term. And this is what super parenting is all about. This is what DBTC is all about, is giving the parents the tools and the knowledge to help their children themselves. I am only the coach, and the parents need to know what to do and to be the parents of the child, to love the David and to help the child love their David. So thank you so much for your attention. I hope that you found that interesting, educational, and you got some tips out of this. I'll be more than happy to answer your questions. Just if you have any more issues, interests, concerns, this is my email address, fp@childdbt-parents.com. I am actually having a lot of referrals lately that I cannot take, but what I personally on an individual basis, but what I can do, or what I'm starting to do, I'm opening a Super Parent 101 groups for parents. So I'm only going to be doing the parenting component of the DBTC. And of course, within that, I will teach parents how to teach skills to children. So that's going to be like helping with that as well. So this is unfortunately only open to those parents who live in the United States, and only in 3 states where I am licensed. I'm licensed in New York, New Jersey, and Connecticut. So outside of that, unfortunately, I cannot take anybody. But I'm training other people, and hopefully soon there will be more available clinicians to do this work. So thank you so much. It was a pleasure to be here, and now I'm opening for questioning, Q&A.
Fabulous. Thank you so much, Dr. Perepletchikova. That was, as a parent who has some sensitivity myself, and as the parent of somebody with BPD, that was absolutely fascinating. I want to ask the first question, which really we're all thinking. It's like, if we as parents happen to also be sensitive,
of course you will be, because
how do we overcome that? How do we help our sensitive children if we ourselves are super sensitive?
Exactly, because you will be learning exactly the same things as the child is learning, both the internal controlling factors and external controlling factors, right? As I said, my job is to help parents to know all of that, and then they will be able to address the child's needs, because they will know what to do. Right? You yourself are sensitive, you yourself are struggling, you yourself not quite sure what to do. How can you help the kid, right? You first need to learn yourself, and then you'll be able to learn the kid. So everything that we're learning, we were talking about 3 core senses, right? It's not only with the child that I'm working with that, right? I am working, of course, and most importantly with the parents, so that they themselves can connect to their own self-love, can feel safely, can feel belonging, and from there they'll be able to also model and teach and help the kid. So everything that you see, you're applying to yourself first.
Great. Okay, thank you so much. Before I ask the next question, could you, I've had a request come in for you to turn your screen off so that we can actually see you as you're answering the questions.
Yes.
And we can keep reminding people of your email address if anybody didn't get it down yet. Great. So another question that comes up, and I have a personal interest in this because my child was like this. What if your child is internalizing their emotions? So that like the behavior is not an outward behavior, but it's more of an internal behavior, and they may be frozen or numb, or you know, you're basically not really aware of the level of dysregulation and sensitivity that they are enduring.
Right. So the way we react to things, of course, is going to be different. Emotional dysregulation may not necessarily mean behavioral temper outbursts, right? It indeed can be more of internalizing. Now, internalizing the external controlling factors best if you have a child with this kind of a reacting to the problem, if you have heard about RO, radically open DBT, right? So skills from that RO DBT can be very helpful for teaching your child how to actually express the emotion, not suppress. We're not talking about suppressing, not to regulate downward, because a lot of the time what we're talking about in DBT for adults or adolescents, whatever, is about down regulating the emotion. But that's not only about down regulation. Emotion regulation is about up regulation as well, right? And the expression of the emotion, but the expression of the emotion in a way that is going to be functional as opposed to dysfunctional. And everything that I said in terms of the 3 core senses apply just as well. Everything that I said about the contingency management applied just as well. The only difference is going to be some skills that are taught mostly in RO DBT as opposed to DBT.
Okay, great. And then I have to follow up because I know a lot of people, I don't know what the situation is like in the States, but in Canada, especially in smaller cities and more rural areas, it's actually very difficult to access any kind of DBT, let alone a specialized DBT like DBT-C or RO DBT. So is there some magic solution, some great pithy piece of advice that you could offer for those of us who can't specifically, access those specific treatments?
If I only had a pill.
Yeah, I know.
There are no magic solutions. Everything is hard labor. The only thing that I can offer at this time right now is this one. Validation. 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 Let me tell you what validation is. Validation is about it makes sense. Invalidation means it doesn't make sense. Invalidation is not a dirty word. I, as a psychologist, my job is to invalidate the hell out of people each and every day. What do I mean by that? When I teach a skill, I'm invalidating. When I do cognitive restructuring, I'm invalidating. Why? Because I'm saying something does not make sense. So don't think about invalidation as a bad thing. No. It all depends. There are 3 different levels of invalidation types, actually. So we need to make sure that we do this. Validation, very important, very important. Validation is about cause. Everything is caused. Everything is caused. Everything is caused, right? And validation is highlighting the cause. Validation is what? I understand because it makes sense to me because of course you're very angry at your brother. Are you kidding me? He took your toy and he broke it. I'll be very angry too. I just validated, right? So validation is not about the outcome. Outcome invariably are going to be bad. You're not going to like what just happened. Don't wait to want to validate. That's not going to happen. When you want to, that's no longer about validation. That's about reinforcement. If you like the outcome, it's about reinforcement. In reinforcement, it's about outcome, not cause. We don't care why, right? When the child finally cleaned up their room and we walk in and say, oh my God, you cleaned up your room, high five, awesome. We don't say, but why did you do that, right? Who cares? Maybe he had a brain aneurysm, I don't know, right? So this is about the outcome, right? Validation is not about outcome is bad. It's about the cause. And we need validation like there's no tomorrow. If you want change to happen, I'm going to give you a magic formula. If you want change to happen, this is the magic formula. Validate, I understand why you felt something, thought something, did something. I get it. Because, not that I approve it, not that I'm saying great job, keep doing it. Validation has nothing to do with that. That's reinforcement. When I say I fully understand why you self-harm because it made you feel better, right? It reduces your emotional arousal. I get it. I just validated. I did not say great job, keep doing it. That's validation. I just highlighted why I understand. There's a cause, there's a function behind that behavior. Every behavior has a function. You don't need to agree, and you will not agree whether that behavior was helpful in the moment. It wasn't, but that's not the point. The point is you're communicating to the person, I get it. Why is that so important? So many levels. Number one, emotional validation is an emotional regulation technique. So many studies done on that, blah, blah, right? Now, look at that. We people communicate to each other from a script. We already have a script. I'm going to say that, she's going to say that, I'm going to say that, right? So we come with a script. And if you go with somebody else's script, what's going to happen? You're going to play by their rules. You lost. You immediately lost. What do you need to do? You need to make them play by your rules. How do we do that? Oh, validation is awesome about that, right? So now, what do I mean? Instead of your child coming in and trying to communicate to you by defending himself, by saying, oh, he did it to me, he broke my toy, I was so angry, blah, blah, right? So he, instead of allowing him to try to defend and resist and whatever, if you enter into that, you're going to play by his rules. All you're going to do is contributing to escalation, because what are you going to say that, right? No, he didn't, whatever, right? So instead of that, you're doing a 180. Instead of him saying that, you're saying that. Of course you got very angry at him. Makes all the sense to me. What just happened? Oh, a wonderful thing happened. You just took his script and you threw it away. He's like, oh, what just happened? What? She gets it? She's not going to be upset with me? She's not judging me? What? What's happening? Right? So you just threw out the script. The kid is like, what? And now you're moving in, and now he's playing by your rules. So you're saying, of course I get it. Oh my God, I will be so upset at this. Like there's no tomorrow. Pause. Validation is an emotional regulation technique. You need the person to have some time to process and for emotional arousal to go down. People make a mistake of going from validation change. Validation pause, and you'll see the decrease in that emotional arousal. Sometimes you see when you validate, person deflates. Have you seen that? Those of you who validated, right? Can you imagine this bastard? He did this to me. Oh my God, that's awful. Oh, right? That's decrease in emotional arousal. So allow this to happen. And now what you're going to do is a magical question, question, question. Before I get to the question, 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 let me explain what I mean by this. Now I'm moving, put this aside, the formula aside. Now, a bit of a different piece of information before we get back to the formula. 3 types of invalidation. Corrective feedback, that's what I do as therapist. That's change. Harmful invalidation and traumatic invalidation. Traumatic invalidation is the easiest to explain. Physical, sexual, emotional abuse, right? What's the difference between corrective feedback and harmful invalidation? Critical difference. Corrective feedback. This is your goal, These are your means, they don't connect. Do you want to change course? You want to improve your life and to, get to the life worth living, and you're trying to kill yourself. That just doesn't work, right? So when I say killing yourself is not the most effective way of solving your life problems, I just invalidate it. Do you see that, right? Because I said something does not make sense. So what I'm saying is your goal, not mine, you came to me saying I want to live, right? Your means, trying to kill yourself in the process, and the question mark. When we question, we never invalidate. Why? I'll tell you right now. What is harmful invalidation? This is your goal. These are your means. Do it. Imposition. We as parents do this all the time. And we have to sometimes, a direct prompt, telling children what to do. We have to, nothing too extreme now. Got it. However, we need to balance it out with validation, with corrective feedback, with all of those things, right? So judgments, criticism, sarcasm, all of these things are what? You are defective. There's something wrong with you. So now corrective feedback does not have anything to do with the personal level. It only has to do with the responses. Your response does not meet your goal. It has nothing to do with you personally. Harmful invalidation is about there's something wrong with you. I know better. I'm better than you. I'm going to tell you what to do, right? Imposition. As soon as we impose on any human being in any way, we are harmful invalidating. And as soon as we're imposing on anybody, immediate reaction for anybody, as soon as you tell them what to do, be that adult or child, what kind of reaction do we have? If people tell us what to do, we're going to flip them a bird, maybe mentally, maybe not, right? So, but that is a very normal reaction. It's absolutely normal reaction, right? Because we just got harmful and validated, right? So going back to the formula, validate, I understand because, pause. And now we do question, question, question. Question is genuine curiosity of what is the child actually thinking about the situation. So asking the child doesn't want to go to school. Right? Instead of like, you say, okay, wait a second. So why do you think we even need to go to school? What is this school about, right? What do you think school maybe is there for you? Whatever. You're asking child questions. Of course, you're asking these questions with a goal to get him to go somewhere where you want them to land, such as saying, yeah, I need to do things differently. Yeah, right? So of course, but that is the way. As soon as you start asking questions with a genuine curiosity of mind, not questions like, so why did you do that again? Right? That's not the question we're looking for, right? This is already a judgment implied. This is genuine curiosity. You're actually interested in what they have to say. You're not invalidating. You're implying invalidation because you're implying that something doesn't make sense, but you're not invalidating directly. And the last of that is so validate, pause, question, getting the child to say, oh yeah, I need to do it differently because it wasn't helpful, it wasn't working for me. What are we going to do differently next time? Practice it, reinforce it.
Thank you. I feel like we just got a mini masterclass in validation. And I think for all those people who are looking for something very practical to implement, fabulous. Thank you. Thank you so much. I just learned so much more about validation than I that I knew in the last 4 years of trying to study this. So thank you so much. I want to move to a question. A lot of people have older kids who are listening, teenagers or young adults. So the question around, is it possible for some of this stuff to be dormant when they're children and then it comes out at a later time in their teenage years? Is there a way to sort of kind of how can we test and know that it's kind of sitting there waiting to come out, or is it always going to be triggered by something like a trauma or a serious episode of invalidation?
Emotional sensitivity is a tricky thing in terms of, as you know, for example, that sometimes children who are emotionally sensitive at home, they're climbing walls. At school, they're really good and quiet, and teachers are looking at those parents and saying, your child is misbehaving at school. At home, what are you talking about? You must be bad parents, right? Something wrong that you are doing, right? Because at school, he's an angel, right? So number one, it can be holding, and then at some point, the quantity goes into quality, and you're crossing the threshold of being able to contain and being functional. Of course, trauma. Of course, the lifelong, because some people are sensitive, but they're still able to manage more or less, because there's sensitivity also, there's a range to it, right? So the accumulation of, so there's always an accumulation of, at some point, just tips into the quality, and the quality goes into the clinical realm. Can you test for it? You don't have to test for it. You know that your child is a supersensor. He may not be emotionally dysregulated supersensor, but you know that he's a supersensor, right? Your child is what? Your child is very empathic. Your child is very caring, very supportive. They do experience emotions on a high level still. They may have all other things associated with it, like some difficulty with transition, some attention, right? Not crossing the clinical barrier. Right? You know that you get a supersensor without him or her needing to be dysregulated, Whether or not he will become dysregulated, that, guys, is about the transaction that you have in your family, right? This is the software that you're writing that is either going to help the child to learn what to do with the challenges and just really benefit by the gifts that supersensing is presenting, or is going to push the kid into the clinical range. So there's no test, you will know.
Thank you. We have a couple questions here about cause, I guess. Is it inherited? Is this supersensitivity an inherited trait?
Yes, it's biological sensitivity. You're born with this ability to experience emotions on a high level.
Okay. And in terms of the way that the expression, how does this relate to early trauma? So for example, specifically relating to adopted children who may have had some adverse early childhood experiences.
Not everybody who's emotionally dysregulated may necessarily be a supersensor. You may not be a supersensor and you have sustained multiple traumas, you're going to be emotionally dysregulated. You are sustaining a trauma of being adopted because this is a trauma of the sense of, think about the sense of belonging. Think about sense of safety. Think about sense of self-love. Somebody didn't want me. My biological parents did not want me, right? They gave me away. So all that is being affected. Of course, you don't have to be born a supersensor for all of that to become vulnerable. Absolutely, that can happen. But when we're talking about a supersense, think about the continuum, right? Because some of the things that are behaviorally are happening, we may get confused with that. Think about the continuum. Again, two sides to everything. People who are very emotionally sensitive, that's one extreme. People who are callous, unemotional, and unable to experience emotions on a high level, people experiencing emotions on a very high level, right? So the supersensors are closer to this side, you know, very close, this, right, closer to the middle, whatever, but on the side, right? So this is the kids that we're talking about. The callous and emotional, these are the kids mostly diagnosed with such as conduct disorder kids, right? So conduct disorder kids without treatment, they have higher risk of developing a personality disorder called antisocial personality disorder, right? Children who are emotionally sensitive, they have a higher risk to develop borderline personality disorder, for example, right? Now, behaviorally, these children may look exactly the same. They all are having temper tantrums. They all are climbing walls. Behaviorally look the same in that sense, right? In dysregulation, right? However, there's a huge difference. These are reactive. I just cannot handle it. And my emotion just burst out of me. It's a tsunami. These are proactive. They're doing it with an instrumental function in mind. I'm going to get something out of you. Here we have dysregulated dysregulation. Here we have regulated dysregulation. Child who has conduct disorder with regulated dysregulation may not actually need skills. They're pretty regulated. They know what they're doing, right? It's not that they're becoming emotionally intoxicated. They may be emotional, but they're not emotional. Here we have emotional intoxication with the high level of emotional arousal. At that level, indeed, it's pretty much biologically the same as being drunk, right? Here we have emotional intoxication. Here we have emotionality, but not emotional intoxication. The child pretty much is dysregulated, but with instrumental, in mind. So there's a range in everything, and it's very hard to know sometimes what to do with whom. And not everybody may be necessarily a supersensor who is dysregulated. A lot of information. I know. That's why you need somebody who knows what they're doing. Don't do a brain surgery on yourself or your child.
I'm just thinking, it's like, wow, there's so much nuance and so much complexity in it. Absolutely. And that's my big takeaway from that. Absolutely. Okay, in carrying on with the idea of nuance and complexity, there are a lot of questions about correlation with other mental health issues or misdiagnoses. So one that's come up in particular is depression and the overlap between emotion dysregulation and depression. Is there a correlation there?
Of course, ADHD, sensory processing, depression, anxiety, all of these things, substance use, alcohol use, personality disorders, all of that is correlated, exactly. A lot of the times children are overdiagnosed. Not every child who is a supersensor and emotionally dysregulated indeed has ADHD. Again, can be presenting like ADHD, but not. What is a true ADHD? Very important. True ADHD is this. My brain is a TV that's broken and it's switching channels on me and I don't have a remote. So I am really interested in something and I'm really like doing, and I switch, right? It's switching on me as opposed to I am switching it because I'm bored, because I'm emotionally aroused, because now that is different. That is about sensitivity, boredom, things like that, right? So when we get this under control, a lot of the time that inability to attend goes away, becomes much better, because it's not about the true because ADHD is a biological dysfunction. What they're saying is that the brain development is not commensurate, does not keep up with the body development, right? That's why people can grow out of it. At some point, brain development catches up with the body, right? And then people grow out of it. Not everybody, but with time, children may actually grow out of ADHD. They don't grow out of emotional sensitivity. Misdiagnosed with bipolar disorder. So many times misdiagnosed with bipolar disorder, be that adolescent or a child. Children with DMDD used to be diagnosed with bipolar. This is the difference. Bipolar is mania, depression. Mania, depression. They go back and forth, right? So mania is something that is a consistent amount of time. So this looks like this. Mania, depression, you see, right? What is DMDD? DMDD is this. It's like EEG or EKG, right? So this is the ups and downs are multiple through the day, right? They're fine, something happened, they're back, they're fine, and back, they're fine, and back, they're fine, right? So this is the DMDD, has nothing to do with mania, because mania is a sustained state for a concrete period of time. It's not up and down throughout the day.
So given that there's so much misdiagnosis, so much potential for misdiagnosis, does that then lead you to believe that it's really important to get the right diagnosis, or is there?
Absolutely. Now, diagnoses are labels, 100%, right? Outside, we need those labels because we do research on labels. We need homogeneous population to figure out what works for whom, right? And then we know for this population with emotion sensitive DMDD, this intervention. For conduct disorder children, this intervention. For bipolar children, this intervention, right? They can be quite different. Bipolar is a biological disorder, right? This is this is a chemistry, right? Dysregulated chemistry in the brain, right? Emotional sensitivity by itself, yes, it's biology, but it's not a disorder. It's not a disorder. It's just a heightened sensitivity too, right? If you can call being a super taster with having more taste buds in your mouth and your palate as a disorder, then yes, it's a disorder. It's not in the sense of a psychiatric disorder. Like, so a psychiatric disorder is bipolar, psychosis, right? These are psychiatric disorders. Here we're talking about something that is in many ways a gift, a benefit, an absolute awesome thing to have. All you need to do is not a problem. All you need to do is have an ability to control that, to be able to do this to the tsunami of the wave, right? Like I always give children this example of the Frozen, right? Frozen. Here we go, right? The cartoon Frozen, right? She had the super ability to freeze, right? Things, but it was too powerful. So she almost, I think, killed her sister. But then she was able to gain the ability to control it. And then she was able to do good deeds with it, right? Exactly what I'm talking about here.
So then the other question, or another question that has come up a lot, because we have some parents with older kids and so on, is when is it too late? If we didn't recognize this?
Never. You are 75 and your child is 62, it's never too late to help your child, to love your child, and to do all of the things I talked about.
Thank you so much. I think that's actually a really amazing place to leave it. So, and we've gone way over time. Just about everybody's hung in there with us, and your energy and enthusiasm for this is absolutely just infectious.
Thank you. Well, I can tell you why. I'm a supersensor too. I know. And being a supersensor comes with a lot of energy, by the way, and inspiration.
And it's contagious. It's absolutely contagious. Thank you so very much. If anybody has questions about getting in touch with Dr. Perepletchikova, you can email me at fcprogram@sashbear.org. The email address again was maybe Francesca. Yeah.
Right, yes. F as in Frank, P as in Peter, my initials, Francheska Perepletchikova, at child DBT/parents, plural.com.
Okay. FP.
Yes, thank you.
ChildDBT-parents.com. Okay. We're all typing it in at once. Great. And the recording will go up on our YouTube channel and on the Sashbear website in a week or so, when we have time to do clean up all the little bits of editing that need to be done and get it uploaded. So once again, thanks to you, and thank you to our audience, and thanks to everybody else who helped out today. And
thank you so much for inviting me. Thank you so much for having me and giving me this opportunity to spread the word and to offer hope and to offer tidbits and help in whichever way I can. I am trying to disseminate at whatever speed I can. I'm also trying to write the book still.
That was another question that came up, was if the book's been published yet.
I'm writing it. I promise. Right.
All right. Thank you so much. Good night, everybody.
Thank you for your attention. Bye.